everyone, I am Dr. Priyanka Sachdev here, NEET PG educator on Unacademy. Today I am here to teach you a very important topic about hemato-oncology. We know that in hemato-oncology, we will study today leukemia, one of the important leukemia. We know that leukemias are of two types, myeloid and lymphoid. So today I am here to teach you one of the important myeloid leukemia, that is chronic myeloid leukemia, CML. So without wasting time, I am just starting it. We know that in hematology, we have three types of cells, RBCs, WBCs, platelets. RBCs are known as erythrocytes, WBCs are known as leukocytes, and platelets are known as thrombocytes. We know that leukemia is a malignancy of WBC. So before starting leukemia, I would like to tell you how these WBCs are formed in the bone marrow. That is hematopoiesis. Hematopoiesis, I would like to tell you how WBCs are formed. So in hematopoiesis, all three cells are formed. RBCs, WBCs and platelets. All of them are formed in the bone marrow. Before starting that, I would like to tell you how many types of WBCs are there. WBCs are of two types, granulocytes and agranulocytes. Granulocytes are of three types, neutrophil, eosinophil and basophil, the three which have granules in their cytoplasm. And agranulocytes are the WBC who do not have granules in their cytoplasm. These are monocytes and lymphocytes. So total 5 types of WBCs are there. All of them are formed in the bone marrow. You can see granulocytes have granules in the cytoplasm, neutrophil, eosinophil, basophil. You can see the diagram. This is neutrophil having purple granules, purple pink color granules in the cytoplasm. This is eosinophil having red, brick red granules in the cytoplasm. This is basophil having dark blue or red granules or black granules in the cytoplasm. And these two are agranulocytes, that is lymphocytes, both type of lymphocytes, T and B lymphocytes and monocytes. Both type of lymphocytes, T and B lymphocytes and monocytes. These do not have granules in their cytoplasm. That's why these are known as agranulocytes. So how granulocytes are formed, that is known as granulopoiesis. How lymphocytes are formed is known as lymphopoiesis. So all of them are formed from one cell in the bone marrow, the precursor cell of all, which is known as hematopoietic stem cell. It is a pluripotent stem cell. Just a second. So it is hematopoietic stem cell which give rise to all of these cells. Now listen, this is hematopoietic stem cells. From this cell, RBC is also formed. From this hematopoietic stem cell, platelets are also formed. And from this hematopoietic stem cells, all 5 types of WBCs are formed. That is neutrophil, eosinophil, basophil, monocyte and lymphocyte. Monocyte and lymphocyte. Now from this hematopoietic stem cell, 2 stem cells are formed. One is myeloid stem cell, myeloid stem cell, and one is lymphoid stem cell. So total how many cells has to be formed? So listen, RBC, WBC and 5 type of platelets. So total 7 cells have to be formed from this hematopoietic stem cells. So out of these 7 cells, the lymphoid stem cell will form only lymphocytes. The lymphocytes is formed by lymphoid stem cell. Rest all the 6 cells, that is all the RBCs, all the platelets and the remaining 4 types of WBCs, that is neutrophil, eosinophil, basophil, granulocytes and agranulocytes, the monocytes. These are formed by myeloid stem cell. That's why myeloid stem cell is known as trilineage stem cell, because it is forming the cells of all 3 series, RBCs, WBCs and platelets. So all RBCs, all platelets and all WBCs except lymphocytes are formed by myeloid stem cells. So I hope you got it. So same thing is shown here in the diagram also. See, this is hematopoietic stem cell. So the 2 stem cells formed out of it is myeloid stem cell and lymphoid stem cell. Lymphoid stem cell will form D and T lymphocytes, and myeloid stem cell will form RBCs. It will form WB platelets and the remaining 4 WBCs. Which remaining 4 WBCs? Neutrophil, eosinophil, basophil and monocyte, not the lymphocyte. That's why it is known as, just a second, trilineage cell. Myeloid is trilineage. I hope you got it. So currently I am concerned with WBC only. I will not teach you how RBCs are formed, how platelets are formed. I will teach you how WBCs are formed. So how WBCs are formed, you tell me how WBCs are formed. So this is the summary till now what I have taught you. So hematopoietic stem cell, 2 stem cells are formed. Lymphoid stem cell which give rise to T and B lymphocytes and natural killer cells. And myeloid stem cells which are known as trilineage stem cells. It forms RBCs also in erythroid series. It forms platelet also in megakaryocyte series and it formed remaining 4 types of WBC except lymphocytes. That is granulocyte, all 3 granulocytes, neutrophil, eosinophil, basophil. And from agranulocyte, it is monocyte. That's why it is known as granulocyte monocyte series. I hope you are getting it. So granulopoiesis is the formation of WBCs, granulocytes, and lymphopoiesis is the formation of lymphocytes. Let's see. So let's talk about granulopoiesis. So here, these are the WBCs, how they are formed. So from lymphopoiesis, lymphocytes are formed, and in granulopoiesis, the granulocytes and monocytes are formed. You know, monocytes and macrophage is one and the same thing. When monocyte come in tissue, it is known as macrophage. So out of these all, how many cells, the precursors of how many cells I will tell you. I will tell you the precursors. I will tell you the precursors of neutrophils. You have to learn it to understand CML. I will tell you the precursors of monocytes, and I will tell you the precursors of lymphocytes. So you have to learn the precursors also. So let's talk about neutrophil first. So how neutrophil is formed? As I have told you, all these cells are formed from the first cell, hematopoietic stem cell. So first cell is always hematopoietic stem cell. Last cell is neutrophil. So what are the intermediates in between? So first cell, see here, everyone, the first cell is hematopoietic stem cell. From hematopoietic stem cell, myelomonoblast is formed. Myelomonoblast. So first cell which is formed is myelomonoblast. Here in CML, the mutation will occur in this blast. So from myelomonoblast, myeloblast is formed. Then promyelocyte, myelocyte, metamyelocyte, band forms and neutrophils. So just revise it. See in the diagram. See, this is the diagram. So hematopoietic stem cell is not shown here. From hematopoietic stem cell, this is myeloblast. The first cell which is formed is blast. Blast means myeloblast. Leukemia is a malignancy of blast. So this is myelomonoblast, from which promyelocyte is formed, then myelocyte is formed, then metamyelocyte is formed. So this is promyelocyte, this is myelocyte, this is metamyelocyte, this is band form, and ultimately from band form neutrophils is formed, and neutrophil is coming in the blood. Rest all the things are present in bone marrow only. So let me draw a diagram for you people. Let me draw. So this is a bone marrow. Okay, this is not good. Let me draw another. So this is a bone marrow. Let me draw a bone marrow for you. Okay, inside the bone marrow, this is the first cell. This is hematopoietic stem cell. From hematopoietic stem cell, myeloblast is formed. From myeloblast, promyelocyte, myelocyte, metamyelocyte, then band form, and then neutrophil is formed. So myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, these are present in bone marrow only. And neutrophil, once it is formed, it will move to the blood, in the lumen of the blood. So it will move to the blood and neutrophils will come in the blood. So this is how neutrophils are coming in the blood. The precursor, now mind my words, precursor of neutrophils, that is myeloblast, promyelocyte, myelocyte, metamyelocyte and band form. These 5 precursors are not coming in blood. These are present in bone marrow. These are not coming in blood. When these precursors are coming in blood, it is known as CML. So CML is nothing. It is the arrival of precurrence of neutrophils in the blood. So you have to understand it. You have to understand it. So why they will come in the blood? Because of mutations. I will tell you the mutations. So that was about neutrophil. Let me come on the another cell, that is monocyte. How monocyte is formed? Again, the first cell is same. That is hematopoietic stem cell. From hematopoietic stem cell, here monoblast is formed. वहाँ पे myeloblast था, यहाँ पे monoblast है. From monoblast, promonocyte and monocyte. So very simple. It is simple. So here in the diagram you can see this is myeloblast, monoblast. This is monocyte. This is monocyte, and when monocyte come in tissue, it is known as macrophage. So you know the precursors of neutrophils. You know the precursors of monocyte. Neutrophils के 5 precursor हैं, monocyte के 2 ही precursor हैं. Coming on precursors of lymphocyte. So it is formed from lymphoid series. So here you can see the precursors. It is lymphoblast. वहाँ पे myeloblast था, यहाँ पे lymphoblast है. Lymphoblast से pro-lymphocyte and lymphocyte. So this is how lymphocyte is formed. So lymphocyte are of 2 types, na T and B. So how T and B, the 2 type of lymphocytes are differentiated. The lymphocyte is formed in bone marrow. This all thing is happening in bone marrow. Let me understand you. So this is the bone marrow. You can see this is the bone marrow. Inside the bone marrow, the first cell is lymphoblast. Let me draw. First cell is hematopoietic stem cell. उससे बना lymphoblast. Lymphoblast से बना pro-lymphocyte, then बना lymphocyte. And this lymphocyte is formed in the bone marrow. It will come in the blood. Before coming in the blood, it has to be matured. For maturation, it has 2 options. For maturation, it can remain in bone marrow only for maturation, or it can go in thymus for maturation. If it is remaining in bone marrow for maturation, it is known as B lymphocyte, B for bone marrow. And if it is going in thymus for maturation, it is known as T lymphocyte. So it is the organ of maturation which decides whether it is a B lymphocyte or T lymphocyte. Formation of both the lymphocyte take place in bone marrow, but maturation takes place in different organs. So you can see if maturation is taking place in bone marrow, it is B lymphocyte. If maturation is taking place in thymus, it is known as T lymphocyte. So B and T both will move to the lymph node and ultimately lymph node structure is formed. So ultimately what we have learned, let me summarize. I want to summarize something. So I have told you the precursors of neutrophils. I have told you the precursors of monocyte. And I have told you the precursors of lymphocyte. Who will help me in revising it? All of them are formed from a common cell, hematopoietic stem cell. Hematopoietic stem cells, two stem cells. Myeloblast, you have to learn the name of the blast. You can't afford missing it because all the mutations which I will be doing in the leukemias will be in blast. So myeloblast, the first cell, or lymphoblast. Lymphoblast, the first cell. So there are two type of blast. Lymphoblast se banega. Let me finish this side first. So lymphoblast se banega प्रो लिम्फोसाइट, लिम्फोब्लास्ट से प्रो लिम्फोसाइट और उससे बनेगा लिम्फोसाइट, प्रो लिम्फोसाइट एंड लिम्फोसाइट, लिम्फोब्लास्ट, प्रो लिम्फोसाइट, लिम्फोसाइट. सो दिस इज द प्रिकर्सर्स ऑफ लिम्फोसाइट. माइलोब्लास्ट से बनेगा प्रो माइलोसाइट, देन माइलोसाइट, देन मेटामाइलोसाइट, देन बैंड फॉर्म और उससे बनेगा न्यूट्रोफिल. सो दीज आर द प्रिकर्सर्स ऑफ न्यूट्रोफिल. माइलोब्लास्ट से ही बनेगा प्रो मोनोसाइट और उससे बनेगा मोनोसाइट. सो दीज आर द प्रिकर्सर्स ऑफ मोनोसाइट. सो यू कैन सी न्यूट्रोफिल एंड मोनोसाइट आर फॉर्म्ड फ्रॉम माइलोब्लास्ट एंड lymphocyte are formed from lymphoblast. So blast is the first cell. Blast, it is the arrival of blast in the blood is known as leukemia. Leukemia is nothing, it is the arrival of blast in the blood. Blast occurs in bone marrow. Blast do not occurs in blood. If blast occurs in blood, it is leukemia. So I hope you got it. I hope. So two type of blast we have. We have two type of blast, myeloblast in myeloid leukemias and lymphoblast in lymphoid leukemia. If myeloblast is coming in blood, it will be myeloid leukemia. The two types of myeloid leukemia, AML and CML, one of which I will be teaching today, CML. And if lymphoblast is coming blood, it will be lymphoid leukemia, that is ALL and CLL. So total 4 types of leukemia. So which blast is coming in blood? So if myeloblast is coming, it is myeloid leukemia. If lymphoblast is coming, it is lymphoid leukemia. So if this blast is coming, this is myeloblast. If it will come in blood from leaving the bone marrow, it is coming in blood. It will be myeloid leukemia, AML and CML. What is the difference between the two now? In CML, along with this blast, the other precursors also come in the blood. That is promyelocyte, myelocyte, metamyelocyte, band form, everything will come in the blood. In AML, only blast will come. Other precursors will not come. But blast is coming in both. So you have to mind it. And in lymphoid leukemias, that is ALL and CLL, lymphoblast will come in blood. Lymphoblast, not myeloblast, lymphoblast. Let me start with the topic now. That was a introduction for the topic. For understanding leukemias and lymphomas, you can't afford hematopoiesis. You should understand granulopoiesis and lymphopoiesis first. So let me start leukemias and lymphomas. Now most of the students have confusion. What is the difference, ma'am, between leukemia and lymphoma? What is the difference? Let me tell you the difference now. Okay, so give me a minute. So this is a bone marrow. Inside the bone marrow, this is the first cell, that is hematopoietic stem cell. This is hematopoietic stem cell from which the first cell blast is formed. Now this blast can be myeloblast, can be lymphoblast. Blasts are present in bone marrow, then other precursors are formed and ultimately mature WBC will be formed. It can be neutrophil, it can be eosinophil, basophil, lymphocyte, monocyte. Whatever it is formed in the bone marrow. Once it is formed in the bone marrow, it will come in the blood. What will come in the blood? This is a blood vessel lined by endothelial lining. This is a blood vessel. This is a rough diagram I am drawing. So this WBC, this mature WBC is leaving the bone marrow and coming in the blood. This is a normal phenomenon. If this blast is coming in the blood, if this blast, either myeloblast or lymphoblast, it is coming in blood, it is known as leukemia. Leukemia is the arrival of blast in the blood. After coming in the blood, these are the solid organs. So it can be liver, it can be spleen, it can be multiple lymph nodes. So liver, spleen, lymph node. So these are the solid organs. If these blast after coming in blood enters in these solid organ and causes masses in them, mass in the liver, mass in the spleen, lymph nodes got enlarged, this is known as lymphoma. So lymphoma is a solid organ malignancy, either malignancy of liver, spleen, lymph node. Leukemia is blood malignancy. Leukemia में कहीं mass नहीं मिलेगा. There will be no mass in leukemia, and lymphoma you will find a mass. So that is leukemia and lymphoma. So many students ask me, ma'am, so this is the scenario. You are saying that first leukemia takes place which give rise to lymphoma. So always leukemia precedes lymphoma. Is it the scenario? I will say no. Reverse can also happen. Lymphoma can lead to leukemia also. So reverse can also happen. So it can happen. Okay, how it happens? So these are the solid organs, liver, spleen, multiple lymph nodes. Inside them, lymphocytes are present. So that lymphocytes become malignant. They convert into blast. And those blasts will arise in the blood. So first lymphoma is taking place. And from lymphoma, there is spillover. This is known as spillage of the lymphoma. Spillage and thukna. So spillage of the lymphoma, blast cells in the blood. So blast cells will arrive in the blood, which leads to leukemia. So both the things can happen. Leukemia can lead to lymphoma. Lymphoma can lead to leukemia. So anything can happen. So let me start with leukemia. I hope you got it. I hope. Yes or no? That was difficult. I tried my best. Anyways, let me start with the classification of leukemias and lymphomas. First, talk about lymphoma. So that is the definition of leukemia, lymphoma that I have already taught you. So leukemia is a disease in the bone marrow. In the bone marrow, number of tumor cells, that is blast, will come in the blood. By tumor cells, I mean blast. That is blast cells will arrive in the blood. That is leukemia. And proliferation of these cells in the solid tissue, that is liver, spleen, bone marrow, lymph node, it is known as lymphoma. So leukemia is a malignancy of blood cells. There is primary involvement of the bone marrow. Lymphoma is a solid tumor with primarily involvement of some solid organ, lymph nodes, spleen, liver, or other organs can be there. So that is the thing. Tonsils can be there. Anything can be there. So leukemia can lead to lymphoma. Lymphoma can lead to leukemia. Leukemia can lead to lymphoma. Lymphoma can lead to leukemia. Both things can happen. Done. Let me come on the classification. Let me talk about lymphomas first. Lymphomas are of two types. Hodgkin's lymphoma, non-Hodgkin's lymphoma. Leukemias are also two types. Lymphoid, myeloid. Lymphoid is of two types. Acute, chronic. Acute lymphoid leukemia, ALL. Chronic lymphoid leukemia, CLL. Myeloid again two type, acute and chronic. Acute myeloid leukemia, AML, and chronic myeloid leukemia, CML. So total 4 types of leukemias are there. Today I will be talking about myeloid ones. So myeloid ones are of two types, CML and AML. From CML and AML, I will be talking about CML in this lecture. Let's start with CML. The first lecture today, CML, chronic myeloid leukemia. I suggest all of you, request or advise all of you to make this comparative table with me. So start making this table. CML, AML, ALL, CLL. Compare the 4 leukemias. In what headings? First, write the introduction, definition in each of them, the most common age group for each of them, pathogenesis, the main mutation in each of them, very important. Classification, FAB classification for each of them. Clinical features, lab diagnosis, treatment, and prognostic factors. So you have to make this table with me. Starting with the first one, CML. Write an introduction. What is the definition of CML? In CML, there is leukocytosis. That is increased WBC count. What is normal WBC count in blood? Human blood. Normal WBC count. It is 4,000 to 11,000 per deciliter. It will increase more than 2 lakh. 11,000 की जगह 2 लाख हो जाएंगे. More than 1 lakh or 2 lakh. Increased WBC count. But those WBC are not normal. All of them are immature. These are not normal neutrophil, eosinophil, basophil. These are not normal WBCs. The precursors of them are coming in the blood. So instead of 11,000, WBC become 1 lakh or 2 lakh, but they are immature. They are not normal. They are not mature. First thing, basophilia is also there. Basophils increases tremendously. Splenomegaly, spleen will be enlarged, and there will be Philadelphia chromosome. I will tell you what is Philadelphia chromosome. These are the 4 hallmarks of CML. Write in definition. Age group. It occurs in olds after 50 years of age. Usually, most common age group. Pathogenesis. What is the mutation taking place? So here, a type of mutation takes place known as translocation. In which cell this mutation is taking place? You know this diagram now. So this mutation takes place in myeloblast. So from hematopoietic stem cell, the first cell which is formed in hematopoietic stem cell, this is hematopoietic stem cell inside the bone marrow. The first cell is hematopoietic stem cell. Inside, after this, the first cell formed is myeloblast. So this mutation takes place in myeloblast. So let me draw a myeloblast for you. So I am drawing a cell for you. This is the cytoplasm of the cell. This is the nucleus of the cell. Which cell it is? It is a myeloblast. Myeloblast. All human cells have 23 pairs of chromosome. Yes or no? Yes. So this cell is also having 23 pair. So this is pair number 1, pair number 2, pair number 3, 4, 5, 6, 7, 8, 9. I will not draw all. So take 2 pairs out of it. Pair number 9 and pair number 22. दो pair उठा लो. Let me draw these 2 pairs separately. So let me draw pair number 9. So this is pair number 9. The 2 chromosomes of pair number 9. Let me draw pair number 22. This is pair number 22. The 2 chromosomes, sister chromatids of chromosome 22. So pair number 9 have a gene on it known as ABL. ABL is the name of gene present on chromosome 9. ABL is the name of the gene. 2 genes are present, one on each chromosome. And chromosome 22 have another gene known as BCR. Name of the gene is BCR. It is normally present on chromosome 22. Normally 9. In all of us, inside you, inside me, it happens. It is happening. ABL is present on chromosome 9. BCR is present on chromosome. They are doing their own function. But during this mutation, due to physical, chemical, viral, anything, this mutation takes place, which is known as translocation. Some portion of 9 is given to 22. In exchange of it, some portion of 22 is given to 9. So let's see. Let me do this translocation. So in this translocation, ABL wala portion of 9 is given to 22. So this ABL will move to 22. So let me draw it. So ABL will move to 22. BCR was already present on 22. ABL will also move there. ABL will also move there. So a fusion gene is formed. Can you see? Can you see? A fusion gene is formed. ABL, BCR fusion. A new gene is formed because of fusion of the 2 genes. ABL, BCR gene. In exchange of this ABL, 22 will give a portion of it to 9, which doesn't contain any important gene. So 9 के पास एक फालतू सा portion चला गया. So on 22 a fusion gene is formed. ABL BCR. This is known as ABL BCR fusion gene. Because of this fusion gene, with the help of transcription and translation, a protein is formed, which is known as tyrosine kinase enzyme. Tyrosine kinase enzyme is formed because of this fusion gene. It is abnormal tyrosine kinase, and it will do uncontrolled mutation, which will lead to malignancy, cancer, CML. So that is the pathophysiogenesis. And this all thing is happening inside which cell? It is happening inside a myeloblast. Inside a myeloblast in the bone marrow, the blast, it is happening. So abnormal mutation, abnormal mitosis takes place inside this cell, abnormal mitosis. So it will lead to, so इतने ज़्यादा ये बन जाएंगे कि they will leave the bone marrow and they will come in blood. That will lead to CML. So all these precursors will come in blood. That is myeloblast, promyelocyte, myelocyte, metamyelocyte and band form. So they all will leave the bone marrow and they will come in the blood leading to CML. I hope you got it. So this is a beautiful diagram. See, this is normal C. See first normal. Don't see abnormal. See left hand side. Normally, this is chromosome number 9. The 2 chromosome number 9 containing ABL gene. The 2 ABL gene. This is chromosome number 22 containing BCR gene. Now see during translocation, this ABL is moved to 22. So on 22, can you see this ABL BCR fusion gene formation? ABL BCR fusion gene formation. And in exchange of it, 9 is getting a portion from 22 which doesn't contain important gene. So because of which a abnormal tyrosine kinase is formed. So this is the theory. Normally ABL present on 9. Normally BCR present on 22. Yes, in translocation, ABL which is present on 9 will move to 22. So on 22, the fusion is forming. So this chromosome number 22 is known as Philadelphia chromosome. Philadelphia chromosome is chromosome 22, not 9, because fusion is formed on 22. So BCR is already present on 22. ABL BCR is formed on 22, which is known as Philadelphia chromosome, which will lead to uncontrolled mitosis, which will lead to CML. So ABL BCR fusion gene is the hallmark of CML. Never forget the 3 phases of CML. CML has 3 phases. What is the mnemonic? CAB CAB. CAB. C for chronic phase, A for accelerated phase, B for blast phase. So how many? So all the precursors are coming in the blood now, as I have told you. Where is the diagram? Let me see. Just a second. Okay, so there is no diagram. Okay, so all the precursors are coming in the blood now, as I have told you. So this is a bone marrow. This is the first cell, that is hematopoietic stem cell. This is myeloblast. This is promyelocyte, myelocyte, metamyelocyte and band form. So all of them are coming in blood. So these are coming in blood. This is a blood vessel. So in the blood vessel, you have to see for deciding the phase how many blasts are coming. तुम्हें सबसे मतलब नहीं है, तुम्हें से blast से मतलब है. So how many? What is the percentage of blast cells in the blood? So depending on it, you divide it into 3 phases. So if blast, I mean myeloblast. So if blasts are less than 10%, it is chronic phase. 10 to 20% or 19%, it is accelerated. 10 to 19, 10 to 19, and more than 20%, it is blastic phase. So how many percentage of blast is coming in the blood? Coming on clinical features. So patient presents with, now listen, bone marrow was usually, this is a hematopoietic stem cell. It forms all WBC, it forms RBCs also, and it forms platelet also. RBC और platelet भी बनाता है, RBCs भी बनते हैं, platelets भी बनते हैं, apart from WBCs, hematopoietic stem cells. Now WBCs, this myeloblast is becoming abnormal. So it is doing abnormal mitosis, uncontrolled mitosis because of this ABL BCR fusion. So it will replace all other cells in the bone marrow. So in the bone marrow, RBCs will not be formed, patient will have anemia. Platelets will not be formed, patient will have bleeding. And WBCs are formed. You say कि ma'am WBC, so instead of 11,000 there are 2 lakh, you told us. So why patient is having infections? Why patient is predisposed to infections? Why patient is immunocompromised? Still, although WBCs instead of 11,000, these are 1 lakh or 2 lakh, but all of them are immature. काम के तो कुछ नहीं है ना, सबके सब immature हैं. So all 3 deficiencies, RBC deficiency lead to anemia, platelet deficiency lead to bleeding, and WBC deficiency, normal mature WBC deficiency leads to infection. All other WBCs are immature, so that is the problem. And patient is having hypermetabolism due to abnormal mitosis in the bone marrow. Patient will have weight loss, patient will have lassitude, patient will have anorexia and night sweats. Patient will have abnormal splenomegaly, massive splenomegaly, because all the abnormal cells will be killed in the spleen. So spleen will be enlarged. So these are the clinical features. Coming on lab findings. What are the laboratory findings? So I will tell you laboratory findings in 5 headings. Blood picture, bone marrow picture, cytogenetics, cytochemistry, others. So blood picture, as I have told you, patient have anemia and thrombocytopenia. Regarding RBC, RBCs are less. Regarding platelet are less. Regarding WBC, there is marked leukocytosis. WBC count is more than 2 lakh instead of 11,000. But all of them are immature. And there are many basophils and eosinophils. So see the picture. So can you see the blood picture? This is the blood picture. Everyone see what you can see. What type of WBC you can see? I can see this is a normal neutrophil. Apart from it, this is a normal eosinophil. This is a normal basophil. Apart from it, all other cells. Let me mark them. All other cells. So this one, these are premature cells. Some of them are metamyelocytes, some of them promyelocyte, myelocyte, band forms. So these are premature cells. Normal इंसान में ये सब नहीं मिलेंगे. Normal इंसान में सिर्फ normal आपको mature neutrophils मिलेंगे. So that is the blood picture. Coming on bone marrow picture. Bone marrow is hypercellular. Inside bone marrow, it is hypercellularity, and there are more myeloid cells, there are less erythroid cells. So myeloid erythroid ratio, ME ratio, numerator is more, denominator is less. So ME ratio is increased. Erythropoiesis कम हो जाएगा, formation of RBC. Megakaryopoiesis कम हो जाएगा, formation of platelets. So that is about bone marrow. Blood picture हो गया, bone marrow हो गया, cytogenetics पे आ जाइए. In cytogenetics means karyotyping is done. In karyotyping you will find Philadelphia chromosome, chromosome number 22. So in chromosome number 22 you will find 922 translocation. That is cytogenetics. Coming on cytochemistry. In cytochemistry, the special stain used here is NAP or LAP. Neutrophil alkaline phosphatase or leukocyte alkaline phosphatase. So NAP score decreases, which differentiate it from leukemoid reaction. Done. And others may, there is nothing important. Hyperuricemia. Uric acid will increase because there are many cells which are doing uncontrolled mitosis in the bone marrow. All of them will be destroyed. The nucleus, purines and pyrimidines will get converted into uric acid. So hyperuricemia will be there, gout will be there. Treatment, last thing, treatment. How you will treat it? For anemia, give blood. For thrombocytopenia, give platelet. So that is supportive treatment. Anemia है तो blood दे दो. Thrombocytopenia, bleeding हो रहा है तो platelet दे दो. Specific therapy is only one, imatinib. What does imatinib do? It जो ABL BCR fusion gene बना था ना, उसको block कर देगा. So ABL BCR fusion gene, which is formed here on chromosome number 22, it is blocked by a drug known as imatinib. It is very costly, but imatinib is the targeted therapy. It is the first targeted therapy to be discovered. It inhibits ABL BCR fusion gene, and the myeloblast inside which this is formed, it is apoptosis is done. That cell is killed. So imatinib induces apoptosis in ABL BCR positive cells. So in 97% of the cases it gives complete remission. It comes in the form of a tablet. Daily patient has to take 1 tablet. So but it is costly. So that is the treatment. If before that, अभी तो imatinib देते हैं. Imatinib से पहले bone marrow transplant was the option. So if sibling is present and bone marrow match is there, so bone marrow transplant can be done. or when imatinib was not discovered, chemotherapy was given. Which chemotherapy? That is interferon alpha and other chemotherapy, busulfan, cyclophosphamide, DSF, but not used nowadays after imatinib. So that was all about CML. So I'm having many polls, MCQs for the CML. I will launch few of them. A peripheral smear with increased neutrophil, increased basophil, increased eosinophil and platelet is likely to be suggestive of which malignancy? Your options are AML, ALL, CML and myelodysplastic syndrome. So of course there is increased neutrophil, eosinophil, basophil. So answer is no doubt it is CML. Done. Answer is C. ABL BCR hybrid gene is present in which malignancy? So your options are Burkitt lymphoma, retinoblastoma, breast carcinoma and CML. Very easy. Abhi padha na. That's why it is easy. So ABL BCR fusion is seen in CML. So the correct answer here is D. है ना? So these are the questions you can see. The whole scenario, clinical scenario. 60-year male. So clue. Age is more than 50 year. Presented with fatigue क्योंकि anemia है. Weight loss क्योंकि lassitude है. Heaviness in the left hypochondrium. For 6 months, the hemogram shows hemoglobin कम है. Patient is anemic. TLC 5 lakh. So leukocytosis is there. और उसमें क्या क्या है? Platelet is 4 lakh. Platelet normal है. So neutrophils 55%, lymphocyte 4%, monocyte 2%, basophil 6%, metamyelocyte, myelocyte, promyelocyte and blast are there. So ये सब normally नहीं होते हैं. These all are present means the diagnosis is CML. And what is the genetic abnormality? It is translocation 922. So correct answer here is B. Who will tell me the phase of CML looking at the clinical question? So there are 3 phases, na? Chronic, accelerated and blast. So which phase it is? So phase depends on number of blast. Number of blast is 3%. If it is less than 10%, it is chronic. 10 to 19%, it is accelerated. More than 20%, it is blast. So new question can be framed from it. That is, in this question, the phase is chronic. So that is the thing. So you have to look for it. Done. I am done with CML. I am done with the first malignancy CML. So I'm just halting here. So if you want the complete lectures on AML, ALL and CLL also, and apart from it, you want lectures, these are the leukemias, you want lectures, do you want lectures on lymphomas, Hodgkin's and non-Hodgkin's? Say yes or no. If you want it, all of them are available for free of cost. Where? Not on YouTube. They are available on Unacademy Learners app. Go to the Play Store, install Unacademy Learners app from there and just go under NEET PG category. NEET PG as a goal, select it and you will find you have to search my name there. My name is Dr.Priyanka Sachdev. Search my name there. You will find my name there. There is profile link given there below my name. So just click on the profile link, follow it and you will get all my recorded lectures for free there. But for opening the lecture, you require a code for unlocking it. My code is Sachdev10. My name Dr. Priyanka Sachdev. Sachdev10 is the code. SACHDEV Sachdev10. So just unlock the classes and why don't you just do it now after this lecture, after watching this lecture. You just do it now and see rest all the leukemias, lymphomas recordings are available there for free. So why I'm preferring to take lectures on special classes there on Unacademy app. The free classes on Unacademy are known as special classes. So go under special classes. The paid one are known as plus. So go under special classes because special classes have these features. These are more interactive than lectures on YouTube. There is a option for poll. There is an option for raise a hand. You will never miss a special class because notification is always there. You will find lecture notes. Notes of CML is also available there. Just go there and install the app and download the PDF of the notes. In paid subscription, there are 2 subscription, Plus and Iconic. Plus and Iconic. So what is the difference between Plus and Iconic? In Plus, you will get live and recorded lectures of Unacademy only. From India's topmost educator, you will get live test, live quiz, printed notes, 25,000 question bank, and you can study on your own device. But in Iconic subscription, along with Unacademy lectures, you will also get prep ladder recorded lectures. So, and yeah, on Plus platform, from 18th of August, my new batch is coming. The name of the batch is Target Next. So what is the specialty of this batch? In this batch, we, the topmost educators from India, we will take all 19 subjects, not subject-wise. We will teach you in a different manner, system-wise. So we will take 1 month system of the body every month. So this month, we are teaching you CVS. We will teach you CVS from anatomy, from physiology, from pathology, from pharmacology, from microbiology, from medicine, from surgery, from pediatrics. So CVS will be taught from all 19 subjects wherever applicable. Next month we will take respi, next month we will take endocrine, next month we will take renal. Likewise, we will cover all system one by one. not subject wise. That is integrated approach. So please take the advantage of this batch. For joining the batch, use the code Sachdev10. You will get additional 10% discount. So remember the code. Apart from this batch, these are the other batches running on the platform. For FMG, it is Focus FMG batch, next 2022 batch, NEET PG Ultra Fast Revision, NEET PG Test and Analysis batch. There is NEET PG 1 month package is also going on. In that package, the cost of the package is only 4,500 rupees only, and if you use the code Sachdev10, you will get additional 10% discount on this 4,500. So last month, 1 month or 20 days are remaining in the exam. So just take the advantage of this package and secure your seat in NEET PG. Done. On platform, more than 25,000 high yielding clinical new pattern questions are available, so you can do your practice there. Done. And 2 more offers for you. If you take a subscription for 12 months, you will get additional 2-month offer. And if you are taking a 4-year subscription, that is the cheapest subscription we are having for 4 years. So that is for Plus, it is 60,000 only. For Iconic, it is 75,000 for 4 years. So that is the cheapest subscription. You can go for monthly installment also. These are the various plans available in Plus, starting from 2 month, 3 month, 6 month, 12 month, 1.5, 2 and 3 and 4 years. And these are the various plans available in Iconic. You can see the rates. And longer the plan, cheaper it is. As I have told you, 4-year plan is the cheapest plan. You can go for monthly installment, which is around 1,200 and 1,400 rupees respectively for 4-year plan in Plus and Iconic. That's it. And if you select any of these plans, any, use the code Sachdev10, SACHDEV. You will get additional 10% discount on these just up before the payment. So remember the code Sachdev10. And do you want it for free? Do you want this Plus subscription for free? Say yes or no. Yes, everyone wants it. Why not? Free में दे रहा है तो क्यों मना करेंगे? For that, I am giving you an offer. I am conducting a scholarship test for that. So please participate in the scholarship test. The winners will get 3-month free Plus subscription. The winners will get. So scholarship test is on pathology, systemic pathology, histopathology. 50 questions will be there. Time is 50 minutes on 22nd August, Sunday, 11 a.m. in the morning, the coming Sunday. Why don't you try your luck, test your knowledge, and just give this test, attempt this test. The link is given on the platform. The name of the test is Patho 50. So just remember the date, Patho 50. If you have any doubt, take the snapshot of the doubt, post it to us. We will answer it in any subject. And we have a Telegram channel also. Let's Crack NEET PG. Join it for getting notification. Please follow my profile link. Please follow. And one more announcement, on 18th of August, I am having a class and images of histopathology. You can watch the recording available on the app. It is for free. So thank you so much. Thank you. Study hard.